Nationally, we see a movement in remodeling our healthcare delivery system in many ways. As North Carolina has moved to Medicaid Managed Care for primary health care and for behavioral health services, we believe we owe it to the consumer and provider communities to thoroughly look at the current landscape for oral health and make recommendations based on an analysis of what other states are doing and lessons learned from the rollout of Medicaid Managed Care so far in North Carolina.
The traditional fee-for-service payment system incentivizes costly, more invasive procedures.
It's very much about what providers are doing to the patient versus what we are doing for the patient.
North Carolina's Medicaid program has transitioned to managed care, but only for behavioral health and primary care health services, and oral health has essentially been carved out.
Future transition to oral health care in managed care is likely, and when this transition happens, we want oral health providers and the system as a whole to be ready for that transition.
That's why the North Carolina Oral Health Collaborative is launching in partnership with the North Carolina Institute of Medicine and the Duke Endowment, the Oral Health Transformation Initiative.
The task force's primary goal will be to help North Carolina enter into that next phase of Medicaid managed care with as much information as possible so that those in charge can make informed decisions about how to include oral health in a way that helps the consumers and that helps the providers and that helps the state as a whole.
So often we don't have the opportunity to really slow down and take a year, 18 months and dig in and engage with other states and engage with experts and really bring people to the table.
The initiative will span a three-phase process where we plan to gather all the information that decision makers would need to know to make an informed decision regarding oral health managed care in North Carolina.
We can't just fund a lot of programs. We do fund programs. We fund school-based oral health programs. We fund medical dental integration programs. But what we've learned in the North Carolina Oral Health Collaborative has certainly helped teach us this over the years, is that these programs can't exist successfully in isolation of true systems change.